Welcome, Professor Neil Mortensen. Professor Mortensen is the President-elect of the Royal College of Surgeons of England and is the past chair of colorectal surgery at Oxford. In addition to having been president of multiple other societies, we're delighted that Neil is an honorary fellow of the American College of Surgeons. Welcome, Professor Mortensen.
Hello, Steve. Good to speak to you.
Good to speak to you and see you in these hard times. So you stepped into the job of President-elect of the Royal College of Surgeons of England at quite an interesting time. In addition to the college headquarters moving and you're assuming the standard responsibilities, I know that you're in large part also responsible for dealing with the COVID-19 pandemic. We'd like to ask you a couple of questions. First one we can talk about is a little bit of the interdisciplinary or perhaps also intercollegiate activities going on. Very impressed with what's happening in the UK with the 4 Royal Colleges. So perhaps you could talk about the role of the Royal Colleges in guidelines as well as in education and retraining of surgeons.
Well, that's part of the British Isles problem. We have lots of colleges rather than one like you. And sometimes we've found it difficult to all be on the same page together, but in a crisis like this, I think really rather brilliantly, we have managed to all speak with one voice, because one of the problems with something like COVID is the multiple sources of information people have about personal protective equipment, about testing, about all the issues related to how you manage your surgical life in a crisis like this. So for general surgery, at least so far, we have agreed, if you like, a standard operating procedure for what we think about general surgical operations. Just this week, we've been getting together a list with all the specialist societies and the 4 Royal Colleges, which includes Ireland, about prioritizing cases. So obviously, if the provision of surgery is poor, as in there aren't enough operating theatres or slots, someone has to decide who gets in first. So with everybody's agreement, and this is really quite an achievement, we've come up with a list to prioritize the cases that get to surgery within a few hours, within 24 hours, within 72 hours, within a week, within a month, and within 3 months. And everybody has agreed. It's quite a difficult thing to achieve, but everybody has agreed that prioritization.
Okay, prioritization of the cases is there, and could you give a guess or estimate, or maybe you know the exact number, how many beds has that resulted in increasing by implementing those guidelines, presumably by the NHS?
Well, it's difficult to say. I mean, the government say that thousands of beds have been freed up because lots of patients have been discharged from hospital. And of course, many beds are being taken up, especially in intensive care units for the COVID crisis, particularly ventilator patients and so on. So those ventilators are both going into intensive care units, into operating theatres, and to some specially provided wards. But obviously, we are only operating on high priority cases. And somebody has to decide in a theatre complex who gets first bite of the cherry if there's a spare theatre. In terms of the general surgery advice, we were pleased that it actually prompted the government to slightly change its view on personal protection and make it, if you like, more protective than their first series of advices. So sometimes if we do speak with one voice, we can change government's view on things.
Maybe you could elaborate on that point for us and tell us what is the stance of the colleges and the government now on personal protective equipment in the general setting, not a known positive patient, but in the general setting. Is somebody presumed to be negative, presumed to be positive, or rapid tests available to help make that determination?
We have very poor testing capacity in the UK. You've probably heard in the news. There are attempts to improve it rapidly. We are relying for patients coming to theatre on using a CT scan of the chest, but of course, radiology departments can be pretty overworked if everybody has to have a chest x-ray before they go to theatre. we are telling our members to assume the patient is COVID positive until proved otherwise. And of course, most patients aren't necessarily definitely known one way or the other. A number of the tests have false negatives. So for any operative procedure, we're advising our surgeon members and fellows to wear full protection.
So full protective, including an N95 mask for all surgeries?
Indeed, yeah.
Okay. Now, the other question has to do with one of the facets of the college that has always been spectacular, and that's education. So around the world, and certainly in the UK, surgeons aren't operating. You're not doing a standard elective colectomy for you or for me. And instead, surgeons are being asked to help out in the intensive care unit or emergency room, wherever it happens to be. What's the role of the colleges in getting surgeons re-educated in these other areas, which may be somewhat remote for senior surgeons?
Sure. Well, we have obviously explained to our members that some of them may have to be, if you like, repurposed for other tasks. We've explained that they have to be, if you like, asked, they have to give permission, they have to be properly trained. If they are unhappy about being put in a situation which they feel unfamiliar about, they should say so, and they're perfectly entitled to say they don't want to do it. But actually most surgical staff who are, for example, being asked to learn how to run a ventilator, for example, are being extremely positive about it. And then in terms of ward work and looking after patients out with the normal surgical burden, for example, in Oxford, about a third of each team are being asked each week to come out of their normal specialty and work in a pan-specialty ward setting, sometimes medical patients on a COVID ward, sometimes not, but helping out more generally with the management of cases. Then, of course, much of what surgeons were doing in terms of clinic time and so on has completely stopped. A lot of that is now being done by telephone or by video calls. And most elective, if you like, routine new outpatient work has completely stopped and dried up.
Yeah, I've been impressed with the NHS campaign directly to patients explaining about telehealth. I think that's actually quite
And then there
brilliant.
has been a campaign to bring back some retired staff, and some people have been volunteering and some people coming back. And then also to increase the workforce, medical students have been graduating early so they can be recruited into the workforce. So all the people I've been speaking to have been very, very complimentary about their colleagues and their desire to both help and be flexible and join in and do their best in very, very difficult circumstances.
So everybody is working very hard. People are coming out of retirement. Medical students are being accelerated, and people are putting in, rolling up their sleeves and getting to it. That can lead to some stress, to say the least, not to mention the disease itself and the need to wear PPE while working. What are the college initiatives for colleges, initiatives for wellness for surgeons during this time?
Well, we have in the 3 years had courses on well-being, and we recognize that this situation is going to be particularly difficult. Many of the specialist societies already have arrangements where surgeons, for example, in specifically neurosurgery, can call their neurosurgery society for advice. But interestingly, all those specialist societies are finding that they are beginning to be overwhelmed by requests for advice. The College of Surgeons in London, my college, has always had a sort of helpline, if you like, and the call is answered and then triaged. And we recognize that even that's not going to be enough. So we're now arranging from the next couple of days, it should be rolling out, that our members will join a helpline, and there's a company called Health Assured which run this, and they are mainly people who are able to give advice about emotional and psychological problems in the first place. If the person ringing up particularly wants help with a professional issue, then we have a long list arranged by specialty of, if you like, volunteer surgeons, senior surgeons, experienced surgeons who are there to help and give professional advice too. And of course, there may be some of our colleagues being placed in extremely difficult situations. You know, you're being asked to do a surgery on somebody and there isn't the right kit available. What do? Do you say, I'm not going to do it? Or do you put yourself and your family at risk because you want to save the patient's life or help save the patient's life? And then, of course, there'll be the guilt, whichever decision you make, and there are going to be some tough talks to get through and the situation to get through for our members, I think.
Okay, well, you spoke about what you're doing for your members, and you mentioned the word advice. So I'd like to ask what advice you have for our members and fellows in the U.S., with the exception of New York. The vast majority of the U.S. is behind the curve that you've seen in London, Milan, Madrid, now New York. So we very much value your advice here as to how we should proceed.
Well, your college website has some excellent advice. So I think the first word of advice is read everything you can about COVID-19, right from the surgical literature to the, if you like, science literature, and read up a bit about what happens in intensive care unit and all about ventilators, because you need to be prepared. I think lots of people don't think it can possibly happen to them, but I think the experience is that it is going to happen to you and you can't be prepared enough. So I think preparation is what you need to do.
Well, I very much appreciate your insights, and I thank you for your time today and your expertise, sharing your thoughts with us. I wish you and your family and all of the fellows and staff of the college good health, sustained safety throughout this pandemic. Look forward to seeing you in person in your new headquarters, as well as here at the ACS when all of this pandemic is behind us.
And my best wishes to you and to all yours too. Good night.